Grady, thank you for joining me today. How are you?
Good. How are you?
I'm doing great. Thank you. I'm excited to chat with you today. We met in kind of passing briefly at my gym recently when you were there giving a seminar on gut health. And
Mhm.
I love the perspective you have on it. I love the perspective that you give on it as far as how it relates to people's performance. And so I really want to dive into kind of all things gut health related today, but I know you do a lot more than that. So I was going to let you have a little time to talk about who you are. So I'm just going to let you give your little bio, your little spiel, and then we'll dive in.
Yeah. So I'm a chiropractor by trade. So I went to chiropractic school. But while I was there, I found a whole lot of other things to learn about and dive into. So I'm also a type 1 diabetic myself. So I'm started to get it really into the internal side of health and narrowing down on my nutrition and how just everything in my lifestyle can affect how then my body performs and functions, and then also how that made it so much easier for me to control my blood sugar, being a type 1 diabetic. So being a type 1 diabetic has always been kind of a blessing for me because it's a great window into how my body's functioning. And so I can kind of see how well, a certain strategy is actually working for me. So that's kind of what got me into more of the internal side of things. And then I just, have really have had a passion for that because of it.
Yeah, that's awesome. What have you, I'm just curious on a personal level, as far as once you started really diving into that more, um, what changes have you noticed as far as you managing your insulin levels and your blood sugar levels and how that all relates to then your performance?
Yeah. So, um, I've been an athlete for most of my life, and I became a type 1 diabetic when I was in sixth grade, so about 12 years old, and so I was a wrestler at that time, and my performance at that time, obviously being my blood sugar being like almost 400 when I was diagnosed, you could definitely tell on the wrestling mat, just wasn't performing very well. Then obviously getting treatment and getting my insulin, everything seemed to normalize. But at the same time, there'd be every now and then that my dad would notice, like, he would just tell me, like, you just look like you're in cement out there, like you're not moving very well. And then we check my blood sugar and it'd be like, in the 200s. And so just that in and of itself can really impact your performance in the moment. If your blood sugar is high or even if it's low, a lot of times performance will significantly decrease, whether it be strength or reaction time, or both. It can be really impacted by those things. And so narrowing in on my diet really helped me control my blood sugar much easier. And so, because like I went from being the worst of the worst, like eating a bunch of crap and just not taking care of myself from a just a lifestyle and diet aspect. Always try to be really good about managing my blood sugar, but didn't think how my diet could make that so much easier. And so, as I got better and better at it, I just saw my numbers being much more consistent, and therefore my performance being that much more consistent then as well. And so, it started off with just kind of eating like a normal person again, because I was playing football as well, so it was just all about eating as much as I possibly could. And then I just was like, okay, I need to stop this. This is not sustainable. So I just kind of started eating like a normal person relatively, and then it became getting healthier and healthier choices, to where for right now, or for the most part right now, I eat fairly low carb, so basically like meat and vegetables, is kind of what I stick to. And um and doing that, man, it's so much easier to control my blood sugar, and at the same time my performance in the gym and in work and everything else just works out so much better, not only from that blood sugar aspect that I talked about, but then at the same time from an energy level perspective, and then also like hormones too, have largely been impacted by it as well.
Awesome. Awesome. I love that. Diving into that a little bit further, especially kind of where you ended off. So, by cleaning up how you're eating more just like proteins, veggies, that sort of thing. You mentioned like performance improved, hormones improved, all that sort of thing. What is it about like eating just real whole foods compared to eating a lot of like those starchy vegetable, not the starchy vegetables aren't whole foods, but eating
Mhm.
more of the like less carbs or the less processed foods? What is it that like changes in the gut between those two sides part those two aspects?
Yeah, so especially where it relates to the gut is largely the inflammatory aspect. And so when you're eating a lot of just junk, there's a lot of inflammatory things in that junk. Both, obviously, we think about sugar being inflammatory towards the system, but then you have a lot of other things that are in there as well, like processed fats, even polyunsaturated fatty acids, like a lot of vegetable oils, corn oil, peanut oil. All those things are really inflammatory, not only for the gut, but then when you are absorbing them and your body's trying to metabolize them, that creates an inflammatory process in other areas as well. Um, and then at the same time, you also have a lot of foods that your immune system is sensitive to. So not necessarily creating an allergic reaction, but more so a delayed sensitivity. So maybe reacting to it an hour, 2 hours, even up to 3 days later, your body's kind of mounting an immune response to that food, which just kind of spreads inflammation throughout the body. And so when you're working out specifically, your body is breaking down that tissue, which is going to end up creating an inflammatory response, which is a good thing because you need to break down that old worn out tissue so new good tissue can be rebuilt and you get stronger from it. But if you have a whole lot of inflammation flying around already, then you're going to be breaking down a heck of a lot more than you really need to, and you aren't going to be recovering as fast then too. And so it's really important to help with recovery by making sure that you have as little inflammation flying around already before you even go and work out. And so that's where diet really comes in a big way. Is if you're eating a lot of inflammatory stuff, then your body's not going to be primed for that recovery phase, which is really where we gain a lot of our progress and a lot of our improvements is in that recovery phase. And so making sure your body has not only low inflammatory food, but then also, good food too, to make sure that you're able to use those nutrients and recover.
As far as I mean, obviously, if we don't recover, we can't perform well in general, but
Mhm.
having these high inflammatory processes going on, does it also impact like energy level, strength, things like that, like in the actual workout itself?
Yeah, yeah. So especially where it comes into energy levels, when you have a lot of inflammation flying around, it takes a lot of energy for your body to try and clear that stuff out, and just work in general. And so from just a pure energy level, it can be largely impacted by that inflammation. And then when you're actually then working out, especially in the CrossFit realm, or really any realm where you're working out pretty consistently throughout the week, you're a lot of times you are maybe a little bit sore from that last workout. And so and that's where it kind of comes back to that inflammatory load. If you're already dealing with a lot of inflammation and then you're continuing to break down your body, it's not going to recover as fast. So then that next workout that you have is going to be not as well as it could have been, because you're still fighting that soreness.
Got it. Makes absolute sense. When so going away from the inflammation a little bit, we will circle back
Mhm.
to it. But like there's definitely people who it's like, I eat clean, I eat well, I eat enough food, which is sometimes debatable still, but I will
Yeah.
just go with it. But like they still aren't performing well or recovering well. And some of that can come down to as far as how the gut is actually absorbing the food.
Hmm.
What are some reasons that our bodies may just not absorb what we're actually giving it?
Yeah. So one of the biggest ones and one of the most common ones that I see when I'm working with my patients is is that they're not digesting well. And that can be for several different reasons, but one of the biggest ones is usually the stomach. So the stomach produces acid to help activate enzymes to break down the food, specifically protein for the most part. And then at the same time, it activates certain cofactors and things that help you absorb some of those nutrients from the food too. So it ionizes minerals so you can absorb them much easier. And some other things that to help pull in B12 and folate and stuff like that. And so if your stomach's not producing enough acid, then you're not going to be digesting that food as well as you need to, and also then not absorbing those nutrients like you need to. And therefore, essentially, you're just going to have expensive poop at that point because it's just going to be running right through you and you're not actually getting the good stuff from the food. And then at the same time, if you're not digesting that food just kind of sits in your GI tract. It rots and putrefies and creates a lot of inflammation in and of itself, which then can produce a lot of inflammation and kind of wearing down that gut lining as well. And when you wear down that gut lining, you start to have very poor absorption. And at the same time, you start absorbing things that shouldn't be absorbed and then having a hard time absorbing things that need to be absorbed. Where that comes in is kind of that leaky gut scenario where the tight junctions in between the cells start to get loose and you start getting bigger proteins getting into the bloodstream that shouldn't be getting in there, which then your body identifies as foreign and starts creating that immune response. So you're kind of getting, a double-edged sword there where you can't absorb the things you need to absorb, and then you're also not or then you're also absorbing things that you're not supposed to be absorbing them.
Is there a reason? Well, I'm sure there is a reason, but what are some reasons behind our stomachs not producing the acid that we need?
Yeah, so there's a couple different things that can do that. One of the common things is stress. Stress is a very broad term. Oftentimes when I say stress, people think of just mental, emotional stress, but that's just one component. Stress comes in many different forms. It could be from physical stress. So obviously overtraining can do that. And then at the same time, chemical stress. So whether that be from an external source, like you're breathing air that has a bunch of toxins in it, you're drinking water that has that's not clean, or you're putting stuff on your skin, or you're putting stuff in your hair that has a lot of toxins in there, that can cause a lot of stress on the body and cause a lot of toxicity to build up. And then at the same time, that those thoughts and traumas, mental emotional traumas can build up to where you have a hard time fighting off or adapting to those other stressors. So I think it's important to try to identify all the different types of stress that's occurring on your body and trying to remove them. Some of the easiest are some of those things that I talked about, like making sure you're drinking clean water and breathing clean air. Those are two really easy ones that you can knock out and make sure you're getting on a consistent basis, which can take a lot of stress off. But then at the same time, you can have some internal chemical stress, and that's mainly in regards to blood sugar regulation. Blood sugar regulation is one of the biggest stressors for a lot of people, even when they don't even realize it. And so if you're not eating frequently enough, then your blood sugar is likely dropping low a lot. And then at the same time, if you're only eating carbs to bring that blood sugar back up, then it's spiking. So yes, you are bringing it back up, but there's nothing to hold it there. So it comes back down just as fast. So making sure you're having protein frequently throughout the day will help keep that blood sugar a lot more stable and take a lot of stress off of your system then too.
And then in reverse of that, is there, like, I'm sure there's people who get like high acid in the stomach as well. What does that cause?
Yeah, so with high acid in the stomach, a lot of times that actually comes from organic acids that are being created when that food is rotting and putrefying in the stomach. And so a lot of times the like acid reflux, indigestion type symptoms actually come from low stomach acid production. And so a lot of times we actually give them hydrochloric acid, which is stomach acid, to help digest the food more fully. So that way that food just doesn't sit there and create more inflammation in those organic acids, which end up kind of wearing down that mucus lining of the gut and the stomach, and creates that's what creates that burning sensation then too. And so for the most part, I find that low stomach acid is kind of the cause for all that stuff. It very few times do I find that it is a pure high stomach acid. In those cases, though, it's just about building up that mucus lining, and so like aloe vera juice and stuff like that can help you build up that mucus lining. And then, like you said, you got to identify why are they producing too much acid, and that usually comes back to something that's triggering more of an immune response. So something that's triggering inflammation oftentimes is what's producing that, and that can be a lot of different things. Most commonly, obviously, like we talked about, is food, but there's other things that can do that then too.
Um, this conversation got me curious now. We see alkaline waters everywhere now in the stores. Is there even a need for that, being that most of us have low acid rather than high?
Yeah. So with the alkaline water, I think it's very much hyped up. And I think because there's a lot of people that do notice a big difference when they switch over to alkaline water or something like that. And I think that has a lot more to do with the fact that they're getting clean water and getting it consistently, and maybe a little bit less to do with the fact that it's alkaline, because once it hits your stomach, it's going to be getting neutralized, and your body's going to be, in a response to that alkalinity, it's going to be producing more acid. And so yeah, so that's kind of my theory on that. I know a lot of people may disagree or agree with it, but I think it has a lot more to do with the fact that it's clean water versus alkaline water. And but there is, I think, something to be said about maybe minimizing that while you're eating food, because that may kind of neutralize some of that acid to where you're not going to digest quite as well. So maybe just having enough sips of water to keep your mouth going, but not enough to where it's going to neutralize a lot of that acid.
Is there continuing on this conversation with acidic and alkaline?
Mm-hmm.
I know certain drinks and things like that are a little more acidic than others. Is there any pros or cons to drinking more of those, I know coffee can be highly acidic. Is without getting into the whole is caffeine good or bad for you conversation,
Mm-hmm.
from the acidity side of things, is there something too much coffee, too many acidic drinks can cause?
Um, I think with anything, if you're taking it in excess, there's only so much your body can adapt to, and so moderation is always, I think, always a safe bet. But as far as the acidity of certain things, I wouldn't pay too much attention to it unless, like I said, you're consuming it every day and or maybe several times a day. Then you might start running into problems with that. But like I said, a lot of times people need a little bit more stomach acid. So I know it's getting more popular to have add lemon to your water, and or maybe take a shot of apple cider vinegar. And for the most part, people largely benefit from those types of things because like I said, it kind of helps increase that stomach acid or lower that pH to where it's activating those enzymes a little bit better. So a lot of times those are positive, um, as long as you're keeping it within reason. So pop and stuff like that obviously is still not good, but as long as it's coming from a good source, it's usually pretty safe.
Awesome. Switching subjects or switching directions a little bit. I know food timing can also have a big role in how we digest food, inflammation that's
Mm-hmm.
caused because of that. I would love for you to dive into some of that, because I know that's always a question with people, is when should I eat before workouts and after workouts? And so what light can you shed on that?
Yeah. So Yeah, just describing why this is important is because you have your parasympathetic side of the nervous system and you have your sympathetic side of the nervous system, which is sympathetic side is that fight or flight response side. Parasympathetic side is that rest and digest healing sort of side. And so they're always kind of fighting for power over that nervous system. And so when you're working out, your body is going to be preferentially going into that more of that sympathetic mode where it's driving blood into the big muscles and away from the gut. So if you have a bunch of food in your stomach while you're working out, one, your workout's going to be suffering because it's your body's not going to totally abandon your gut because there's still food in there. While at the same time, it's abandoning it enough to where you're not digesting that well enough to where, okay, now you're creating a inflammatory scenario, even if you are eating good food. So you definitely want to space your food out away from your workouts. And now the question always is, okay, how much do I need to space that out? And it kind of depends on each person. Each person has a different transit time through their GI tract. So what I usually suggest for people as a starting spot is if you're eating before a workout, that food usually takes a while before it gets through. So I usually have people wait 2 hours before they're going to work out if they're going to eat a fairly substantial meal, and then you can try working it in from there. So try an hour 45, hour 30. I probably wouldn't go much further in than that. And then it also kind of depends a little bit on what you're eating too. So like if it's a heavier meal where you got lots of protein, fats, and stuff like that, you're gonna probably have to wait a lot longer. Whereas if you're just eating like a very simple carb and or maybe like a protein shake where it's already digested for you, your body just has to absorb it. Then that can be like maybe 30 minutes and you'll be fine. And then after workouts, you still want to give your body a little bit of time to get back into that parasympathetic mode, get more blood back into the gut before you start pounding, the protein or steak or whatever it is. And so at that point, I usually wait at least 15 minutes. I would say probably 30 minutes is probably a good amount of time before you start eating like heavy food. Again, if you're eating or drinking a protein shake, that 15-minute mark is probably a good mark to start at. But you want to make sure you give yourself plenty of window because you want to make sure, one, you're going to be absorbing all that food you're intaking, and then at the same time not then creating more inflammation because there's not enough blood in your gut to get everything going.
Awesome. From a change directions actually. When talking about gut health, I think a lot of people like kind of think, well, since like digestively I seem to be okay, I think I'm fine. What are some other signs or symptoms that someone might have that tells them like maybe the gut should be or maybe your gut health should be assessed?
Yeah. So obviously if you're having like gas, bloating, pain in your abdomen, that's a pretty clear sign that something's going on that's not working well. But some other common things that seem like just normal things that people do that aren't necessarily actually normal are things like belching and burping. Those are pretty clear signs that you're not producing enough stomach acid, which is creating those gases of that rotting and putrefying food in there. And so belching and burping is a very common one. Like I said, indigestion, acid reflux, that's another common one. And your stools. So if you're only having one bowel movement a day or every other day, that's obviously not good. We need to have at least probably 2 or 3 a day for optimal kind of gut function, especially if you're eating a decent amount. And I'm assuming people listening to this podcast are people who eat a little bit more because they're working out more. And so if you're eating a pretty good amount throughout the day, you should be going to the bathroom at least probably 2 or 3 times a day.
Awesome. How does hydration play into all of this?
Yeah, so hydration is obviously very important for a lot of different processes in the body. But at the same time, staying hydrated oftentimes will help with transit time of food. So it helps kind of with bowel movements in that regard. And then at the same time, helps a lot with indirectly kind of producing stomach acid, because there's a lot of different things, or there's several minerals that your body needs to actually produce stomach acid that can be found in water. It can be found in other things too. So it's not like it's necessary, but it is very helpful. And then at the same time, like being dehydrated puts a pretty big stress on the body. And so typically you're not going to be getting as much good stimulation to that gut. So again, kind of creates that scenario where you may be getting the right foods in, but it may be causing inflammation because that food's just kind of sitting in there and not moving.
Awesome. Okay, cool. Last thing I wanted to dive into today from a like gut health, inflammation, blood sugar, like you name it standpoint, however you want to answer this. Artificial sweeteners. I know there's a ton of different ones out there. There's all sorts of views as far as which ones are good, which ones are bad. Can you shine any light on which ones like to avoid and why, or if any of them are okay?
Yeah. So the couple that I like are the two that I like the most are stevia and monk fruit. And then xylitol is okay. Those are usually the ones that I kind of cut off at. The rest of them produce issues in their own ways. And so a couple different ways is like aspartame produces a lot of toxicity in the body. So your liver has to clear that out. And so it's just another burden on your liver trying to detoxify and get rid of it. It's also a neurotoxin, and so it can impact your brain function as well. And then other ones produce inflammation, like I said, in a couple different ways. A lot of it has to do with the amount of burden that it puts on the liver, because it's harder to process those sugars versus the more natural sugars like glucose and the easier sugars to break down. And so it's just harder on your system to metabolize those things.
Okay, thank you for that. All right, start closing it out. For someone listening to this, like they're kind of curious, think I might have something that might need addressed. How can they start figuring out for themselves, like what, like, or two things. If they can tell they're reacting to something, how can they start figuring out for themselves what they're reacting to? And then secondary question, just to start improving gut health, like 2 or 3 things that they can start doing at home on their own.
Yeah. So like identifying foods that your body doesn't do well with is easy in a theoretical sense, but harder in an actual application sense, because it requires removing a lot of foods, because you got to figure out which food it is. And so the tough thing about food reactions is that it can take anywhere from a couple hours to 3 days later before your body actually creates that response to where you can identify that food that's messing you up. And so if you eat, a piece of bread today, and that those symptoms may not show up till 2 days later. So what's hard is you gotta do basically an elimination diet if you're doing this on your own. And so one of the probably the best elimination diet without being too crazy is probably a carnivore diet, because at least I find most people do pretty well with animal products, meaning that their immune system doesn't react to them. And so doing a carnivore diet for a couple weeks, maybe even a couple months, getting your body to where it's at a very baseline kind of health. You get to where you feel pretty good, And then you start adding foods back in very, very slowly. So like at a week at a time, let's say I want to add back in broccoli. So I eat broccoli at least once a day for, a week at a time. At that end of that week, if I don't feel like I um, have changed at all, whether it be energy levels, brain function, gut, whatever it is, everything's stayed pretty well and I still feel pretty well. Okay, I can eat broccoli now. Now you can add in that next food and do that for a week. Because that way you have that week span to get that constant exposure. And that way there's no confusion on, okay, I had broccoli, but I also put some garlic on it. Was it the garlic or was it the broccoli? So you don't want to add too many variables in there, because otherwise you're not going to know which one it is that you're flaring yourself up with. The other quicker way to do it is just to get a food sensitivity test done, which is just a blood test. And it allows you to be a little bit more specific and really know, is my immune system reacting to it, or is it fine? So there's easy and cheap ways to do it, or there's quick and more expensive ways to do it. And then as far as what people can do on the day-to-day to kind of help their digestion or their gut function in general, I would say one of them being getting movement in, especially like after a big meal. If you go for a very light walk, almost like you're just going shopping, that type of slow walk will help with gut motility and getting that food to move in nice and easy. And then making sure you're fully present when you're eating, because a lot of times we're not very present. We're thinking about all these other things that we have going on that day, and we're just scarfing our food down. And so we're not actually chewing our food fully, and all those big particles of food are getting into our stomach. And even if we have enough stomach acid, it may just be too much food. So the more surface area we have, meaning the more we break down that food before we even swallow it, the easier it will be for your stomach to then digest all that food. So chewing your food very thoroughly and having smaller bites really helps take the burden off of your internal gut, and can really help with digestion and gut symptoms.
Awesome. I love that last one. It's a great reminder for myself too.
Yeah.
Sometimes you're just in a hurry.
Yeah, exactly. Yeah.
Awesome. Well, Grady, you shared some great information today. If someone has more questions, just wants to reach out to you, wants to find out more about what you are about, where can they find you?
Yeah, I'm on Instagram and Facebook. Optimal. Instagram is optimal.healing.solutions. And then on Facebook, Optimal Healing Solutions. And then I have my website, optimalhealingsolutions.com. And then if they want to schedule an appointment or a consultation or anything, they can either do that online on my website, or they can call me 480 447 6581.
And then on that note, do you do anything, just so the listeners know, do you do anything virtually, or does it all have to be in person in the state?
Yeah, so right now I'm just doing in-person stuff, but I'm working on getting my website set up to where I can do online stuff. So
Awesome.
that should be hopefully within a month or so.
Okay, awesome. Very cool. Well, thank you so much for your time today. Greatly appreciate it. This was great information.
Yeah, thank you for having me.